Hello, my name's Angela from Angela Simpson Functional Medicine Physiotherapy. Thanks for joining me, and I'd like to talk to you today about pelvic pain. And chronic pain can be in the category of several different areas in the body. Pelvic pain is a very common one for females, and often this type of pain is more aggravated for females that are cycling at certain times of the month. And sometimes it's there all the time. And so it is really important to figure out where the pain is coming from and what the root cause is. Because often people will be managing pain certain times of month. They will be using anti-inflammatories, whether they be over-the-counter or prescription medication, just so they can cope and make it through their day and complete their life. And if this is happening on a monthly basis, sometimes, like I said, it also is happening at other times of the month. It can be more consistent versus just that one particular time if you're cycling. And it can definitely start to weigh down the body if you're using symptom management such as this to treat the condition, because you're not actually treating it, you're just trying to mask symptoms. And I've seen so many women in my practice that have been dealing with this, and it's just the most common way because the pain sometimes is very severe and sometimes it's really hard for people to manage and they just don't know how else to go about it. But there is another way, and it is actually looking more for the root cause of where the pain is coming from. And pain by nature always has a component of inflammation. And inflammation, typically, it doesn't just come from where you're feeling the pain, but it often comes deeper within the body, more within the whole system of the body. It's often systemic. And inflammation often is controlled and regulated actually in the gut, believe it or not. So if we're not actually managing what we're eating properly, we're eating foods that are higher in inflammation, or we have some other things that might be causing inflammation in our body, setting our systems out of balance. Chronic stress is a big one as well. This can tip off that inflammation buzzer in our brain, and it hurts. When people have pelvic pain, they really are having a hard time managing. And so it is important to dig deep and look further back and look where the problem might have been coming from in the first place, especially if you have had this pain for a long time or it has evolved in different ways. Instead of just chasing the pain and managing the symptoms, it's really important that you look further back and you trace your history and you look at a timeline with a practitioner that's able to listen and piece it all together and look at which systems in the body are out of balance and causing you that pain. And the reality is if you don't manage this pain and you actually just cover it up, what's going to happen several years down the road, and maybe not even several, it could be 2, 3, 5 years from now, the body will continue to signal the pain. You'll continue to manage it in a way that is actually non-optimal in other systems in your body, and you can create even bigger problems. You can create fatty liver, for example, if you're using chronic NSAIDs or prescription medication, which are anti-inflammatories, which actually can cause a host of different health conditions. It can potentially lead to other health conditions as well. It can trigger autoimmunity if the inflammation levels go up and they're unregulated for long enough and the symptoms are just being masked. So it's really important to think, how can I not just get myself out of this pain short term, but how can I figure out where it's coming from and not just manage it, but actually get through it so that I'm feeling better for life by doing some things that help rebalance all of the systems in my body. And so if you want to learn more about this, please let me know. I'm really happy to chat with you about this or some other pain or injury or health condition that's been bothering you for some time, and you continue to look for answers and you need a way to not just manage symptoms, but to actually get you through the symptoms and feeling better and returning to optimal wellness long term. Thanks so much for watching. You can reach me either through the Facebook page, Functional Medicine Physio for Women. You can also go to my YouTube channel, Angela Simpson Functional Medicine, or you can go to my website, www.angelasimpsonfunctionalmedicine.ca. Thank you.